Two, three. Hey, everybody, it's Kevin and it's Zain from RPH Ally. Really excited to be here. I know that Sean and Zain got to do an impromptu meet before, which I was really jealous because it was a fantastic conversation and they're both super nerdy, just like I am. So they could talk about really fun things like we're going to do today. So today is the official launch of Zain's channel. Zain is a leader of Digital Thoughts, a blog that is growing rapidly and submitting a lot of content to RPH Ally, which we absolutely love. But his channel that's going live is the technology channel. And if anybody knows me or Zain, they both know that we love technology and the intersections that it has inside of healthcare and how it kind of moves forward. But Zain, tell me this, bud, right off the bat. You and I have talked about it before, but for the audience to hear, how did you kind of get into technology? Like, where did the passion kind of come from? Why is this channel here?
Yeah, I mean, the passion came from, throughout my life, technology has been kind of the backbone of everything I do. Like, I try to automate everything in my life. I've seen how technology can help people around me. So I've always been a nerd. I've built my own computers since I was like 13. And, I'm kind of the pseudo IT person in my family. Everyone kind of reaches out to me and my other cousin. So that's kind of where the love of technology kind of occurred. I didn't realize technology and healthcare could be they could work symbiotically until about 20 until I graduated. After I graduated, like 2014 or whatever, I was sitting there getting a I was doing a medication reconciliation for a patient. It was taking forever because the patient didn't know exactly what they were on. Then I had to call like 5 pharmacies, and on top of that, there's like inbound orders from all over the place. I'm getting phone calls from nursing like, hey, can you verify this? Why don't we have this and that? So like it's something that really should take like 10, 15 minutes was taking me like an hour. And I was
Wow.
sitting there like, this is ridiculous. We need a better way. So I just kind of looked around and tried to find if there was something out there that could, and this was like way back before, now there's a little bit more with like insurance data that pulls into like Epic and stuff, but back then we really didn't have anything. We were going in blind for most of it, and couldn't find anything. So I was like, okay, let me see what I can do. So I was just kind of thinking up things, whatever. So that's kind of where my startup started, was from like medication reconciliation. And then from there, it kind of evolved into, I wanted to make a cloud-based EHR where for me, it was stupid to me where like, private practice people or whatever were like confined to just their office. Or, I knew a lot of private practice people that
And Zain,
hated.
this was back in 2014, right, buddy? I mean, this isn't after the big COVID push. This is way like 5, 6 years prior, right?
Yeah, no, yeah, exactly. I was way, way too early, way too early. But anyway, so like, I knew, a lot of these private practice people didn't want to deal with servers. They had like archaic backends. Their computers are really old. I'm like, being on the cloud solves that because you don't have to worry about any of it. And then also it keeps them mobile. So me being from Wisconsin and I worked in oncology, we had a lot of second opinions coming through, and we would not know what they were on. The patients didn't know what they were on, nor should they, because half the times we can't even pronounce the drug names. And, so it was really frustrating. So treatments were being delayed, all this. I'm like, this is so stupid. Like I can literally like have a Google Doc and have 30 people typing on it at the same time. And in healthcare, we can't do this. So, and then also healthcare deserts, like we would see people, in these healthcare deserts in Wisconsin, and they would come in with these ailments where you're like, why wasn't this taken care of? And then you find out that they couldn't get to a doctor, or it was too far away, or it got to a point where it had to get really serious to where they either need to be airlifted or ambulance over an hour or so. And that to me just never sat right, right? For me, I got into healthcare to help people. And so that was kind of the genesis of everything. So I like poured 2 years of my life into this. I talked to a bunch of people, did a lot of surveys, figuring out what people wanted, what they didn't want, and I went super granular into it. Maybe one day I'll share the story. I mean, I plan on sharing the story eventually through my newsletter, but we'll see. But anyway, so yeah, unfortunately, it didn't work out. I was also wanted to do telehealth because telehealth to me, like I knew as a clinician that 70% of visits could be over the phone or via video, right?
Yeah.
Because and so like so that's kind of what the platform was going to be, a mobile EHR with telehealth on top of it that freed patients and freed providers, and they allowed people to be seen when they needed to be seen.
So why'd you
And
stick with it, Zane? Like why you went through all the struggle of kind of recognizing a problem, seeing there's a viable solution, getting shut down because no one wanted to be able to, one, pay for it, or two, the technology was so archaic that they weren't willing to push it forward. Then it's like, well, you got to shut it down. It's not going to be able to move forward and be fruitful. What made you go, I'm sticking on this technology train because I want to see a difference? Like, what made you stay with that, and what differences have you seen?
Yeah, man. And so I stayed with it because I saw with my own two eyes that there are people out there trying to solve these issues, because I was talking to them, some of them. And it was a very small community. And I was not on any social media, on LinkedIn or anything. I wish I would have started LinkedIn back then. Maybe I could have met some other people. But I met like people in different um like non-for-profit organizations. I talked to like people in hospital systems, people that I just knew, like tapping into my own network, asking them like, hey, would you be interested? I wouldn't tell them that I was building this thing, but I would ask them like, would you be interested in this? Because I wanted to get their like actual opinion. Like I didn't want their opinion of me to dictate their
Bias.
answers, right?
Uh-huh.
I didn't want to bias them. So yeah, so like there were a lot of people that were super excited. It was just like everyone was like, hey, this is gonna be hard. And then some people didn't really understand how telehealth would work inside of this thing. Like they're like, hey, we like the idea, but we need to physically see our patients. That's, I don't think telehealth will ever work. And me being young at the time, I don't think I was able to relate, like tell my story properly or tell a story properly, because that's the number one thing with like startups or business or really anything in general is, can you tell a story that's compelling enough to people, for people. Like I had an idea, like once I got people talking and I could go through the idea, they loved the idea, but like getting them to understand the idea was a whole different story, right? So
Makes perfect sense.
yeah, no,
Yeah.
I just found this world where there were technologists trying to solve problems that I had, and I was like, why can't I be one of those people solving my own problems? And that's kind of why that's kind of how I kind of careened into it. And yeah, man.
No, I love that, Zane. I mean, I think that, just in general, there's a lot of things connecting dots between healthcare technology and healthcare delivery, like patient services. Like, we want to help somebody one on one. We want to make their lives easier. We want to find ways for them to be able to get past all the obstacles that are in their way to make things smoother and more streamlined in their lives. And what does healthcare technology do for healthcare? The exact same things, right? And then we're trying to translate that over to patient care, which I know you're passionate in. You have backgrounds in, pain management, and I mean, current working in pain management and oncology, with those backgrounds there. Tell me this, Zane. So why did you feel like there's a lot to talk about in technology? We've talked about, doing comparisons of, there's pain pumps and IV pumps, and there's EHR technology, there's app deployment, there's medical devices, there's other health tech, and billable, like behavioral health technology that's out there and just starting to boom. I don't feel like pharmacy is necessarily staying on top of it. The things that are happening in wearable technology, another one that, once again, that is within our wheelhouse to be able to stay on top of and deliver to our patients. So tell me this, buddy, like, why did you feel like not only those things, but also the opportunities out there in healthcare for pharmacists who have a really unique perspective on the entire kind of paradigm of healthcare from kind of beginning to end for patient care and delivery of logistics? Why did you feel like a channel like this needed to exist on RPH Ally in particular?
Um, I mean, I just like talk about the stuff, so I needed some place for me to just kind of stop screaming into the void. I can just scream into the channel, right? No, no, but I think that the one thing about especially like chronic diseases like oncology, pain management, all these things, and like diabetes, hypertension, all literally almost every single chronic disease. I mean, oncology is not a chronic disease, but you know what saying, right? Um, is revolves around medication, adjusting medications, changing medications, drug reactions, all this stuff. And to me, we should be the ones that uh, can take care of it. I mean, if you've ever worked in a clinic or a teaching hospital or anything, side by side with a provider, their default is just to turn around and ask you. I remember being a student in my fourth year and rounding with teams, and I would be the only pharmacist on that team. And the attending would turn around and ask me, like, hey, Zane, what do you think about this? And I'm a fourth year student, right? I mean, so there's huge value in pharmacists, the pharmacy in general. But I think the problem is we I think some of it has to do with our training. We are trained to think one track. We're trained to stay inside the box. We're trained to not really push the envelope too much, right? Because we're like, hey, you know, we got to, this is our lanes. We can't stay in or out of it. Right.
Yep.
And I think that's a disservice because there's so many amazing pharmacists out there. There's so many, I mean, amazing minds in general. And I think that also we are so stuck in the dispensing part of it. Like that's been associated with us for so long. And I was actually just researching, I was writing an article, and it come to find out like in the 50s is when pharmacy, up till the 50s, pharmacists were not even allowed to put labels, like counsel patients on medications, because it was considered like you were stepping on the doctor's toes. So this is, I mean, think about it. Until the 50s, we weren't really even able to counsel. So if you think about it, it's, our profession isn't really grown that much since then, right? I mean, we just were able to counsel and all that stuff. So I mean, it's kind of crazy when I saw that. I'm like, that is nuts. But yeah, I mean, I think there's so many places where pharmacists, like RPM, remote patient monitoring, right?
Yeah.
You know, just general telehealth visits, medication management, everything is medication driven in healthcare, whether we like it or not. And I think in pharmacy school, like many people, I'm sure you had the same classes, are we're taught to obviously manage the disease state, but we're also taught to take as many drugs off the list as we can, because many times you get, you know, I remember seeing as a student, somebody was on a calcium channel blocker, and then they were also on a diuretic, and I just happened to ask the patient, like, hey, why are you taking this diuretic? They didn't have any, like, anything that really, you know, didn't make sense to me at the time. And I asked the doctor, and he's like, oh yeah, he was having edema with the calcium channel blocker. And I'm like, did you guys try like beta blockers or anything? Like, no. uh, so then, you know what I mean, like just little simple questions like that
Yep.
are like things that we are trained to do, but you know, some people just overlook it.
Yeah, I mean, and that's an interesting one. I mean, especially having a geriatric background, like seeing edema with an individual drug and then being able to pull or reduce that dose or change it to be able to avoid the side effect profile. Like that's one thing. But being able to catch those things with technology and then be able to understand how a patient could report those problems and then have technology advise them. I think that's the one missing thing from our profession. And you mentioned kind of feeling boxed in. The box is about to blow up, Zane. Like the things that are happening in digital therapeutics, the things that are coming down the line with robotics, all the other pieces of technology that are coming our way that can be either one, harnessed by us, leveraged by us, and help us advance kind of our profession and career because we're part of those changes of recognizing like all of these tools and being the master of those skills, or they can be utilized to replace. And I think, you know, both are opportunities. But the one thing that's great about knowing more about technology for our profession, and as you mentioned, I mean, there are some folks that are going to be out there that aren't as interested in technology, but there are a lot that are. And the reason they are is because it's changing so rapidly and changing the way that we all do our jobs. And so I think that giving a channel, you know, some life and breath like you do, and you're a humble guy, which I absolutely love, but you don't only dabble, but you like to get into a point of really truly understanding the technology that's out there, the good, the bad, the pros, the cons, and then be able to deliver those to individuals so that they can ascertain some of that knowledge more quickly and pull that together on how does that impact me on a day-to-day regular basis. Like I think that's really special, and why when, you know, you and I got together on this channel for RPH Ally, I knew it was just necessary for the pharmacy profession to be able to see like what is out there, what's coming, what do I need to know about it, and what opportunities do I have to get involved. So I'm stoked about that, buddy. But those are my words. Tell me a little bit more about like what you plan in general. I mean, because the one thing that's great is I'm more boring. You're way more fun. If anybody's read your blog, like they know that you're a funny guy. What is coming to our PH Ally in your technology channel? Like what can folks expect?
I mean, I just want to have fun with it. I think the thing with that technology, and I think I spoke to Sean about this, it's one of the few careers in your in adulthood where you can, outside of like building toys and stuff, like you're told and taught to dream big, and you're told like, hey, the sky's the answer. Like I was listening to a podcast about people that worked in Google. So Google had this thing where they set a benchmark, and they said, how can we blow that benchmark out? Like how can we 10x 100x this? Like this is how these technology companies work. They're not thinking of like, oh hey, you know, let's just make $10 million. No, they're like, how do we make $1 billion? And that's what I love about technology, is it's literally like on the bleeding edge of humanity, right? You're constantly moving and forward. Whether, I mean, there's consequences to it in some cases, but yeah, to your point, you know, I recently wrote about how I would replace myself with a robot. It was kind of tongue in cheek, because at the end I was like, hey, I'm glad you wanted to replace me with a robot, because then I'm allowed to do the things that I was trained to do, like all the dispensing, all the making of drugs, all the checking, all, these things that can be there that are algorithmic, or something that is a yes or no, right? Those can all be automated, and they're going to be automated. And it might be 5 years, 10 years, 2 years, whatever. It's coming down the road, like you said. But the things that they cannot take away is like our mind, like the part in the gray area where, like, what do we do? What are we choosing? Or like that human connection, right? Those are things that the technology cannot take away. And that's the things that we need to focus on. And that's what I want to bring in, is like, I want to push people out of, and I'm not saying like dispensing is bad or anything like that, but I'm just saying that there's going to come a point where that's going to be taken away from us. And if that's taken away from us and we're not prepared, then what do we do? We're done, right? So my thing is, prepare for the worst. I mean, prepare for like the future. And if it doesn't change, it doesn't change, whatever. At least you have an option to kind of look out. If it doesn't change, you just do what you want. But I mean, I just hope to have fun. Hopefully have people kind of think outside the box and really push the envelope, and give people a forum. I was thinking about maybe like just, I love crazy ideas. The crazier the ideas, the better they are. And we can maybe workshop something. Maybe businesses can grow out of it. And I just want to have fun. Honestly, I enjoy this stuff. I really do. And I hope that I can instill that enjoyment into other people, rather than being scared of it, that they embrace it. And that's, if I can get to that point, if people are embracing technology rather than getting scared of it, I have done my job.
Yeah, I love that. That's a perfect sign off right there, buddy. It's just embracing technology, like finding ways, because there's nothing we can do to stop it. Like it's coming in all kinds of different myriad of ways, but understanding it and being able to embrace it and leverage it in our own careers and for our patients, I think is just a really exciting next step for our profession. And if we're reimagining pharmacy together, I'm looking forward to doing it with you, buddy. Check out Zain's newsletter, Digital Thoughts, and then go to rphally.com, have all of your licensure information ready to go, get set up for RPH Ally, and then find Zain's channel, the technology channel, to join and be able to nerd out with all of us. All right. Have a good rest of the evening, everybody. Talk to you soon.